You're listening to the Foreign and International Medical Graduate Show, a podcast to inspire physicians in the process of immigration to the United States and access to graduate medical education. We create meaningful and helpful content that motivates medical students and doctors throughout the world, with the goal of creating a community that supports itself and gives feedback to each other, that stays updated with the most recent tips and advice on how to make it in America and become a successful resident or fellow in the speciality of your dreams. Dr. Alonso Osorio is board certified and residency trained in both emergency and family medicine and will be bringing you 20 years of his personal experiences, struggles, and motivation. We'll be chatting with people like you to talk about the lessons they've learned along their personal path, how to make an impact, and how we can all benefit from it. Also, we'll analyse the current resources available and how to benefit from them. Thanks for joining us. Please enjoy the show.
Hello, superstars, and welcome again to the Foreign and International Medical Graduate Podcast. I'm super excited of being here with you back to back in this spring break, producing some quality information for you all. And today, I have a physician, Dr. Varun Agrawal, that actually, we connected each other about a month ago through the internet in late December, early January, when I initially launched my Facebook group and my YouTube channel and my podcast. And I think he's doing a lot of good stuff for foreign medical graduates. Dr. Varun Agrawal, also known as Dr. Ed, is a nephrologist, currently working at the University Hospital in Burlington, Vermont. And he has his clinical practice of full-time nephrology, and is heavily involved in education of graduate medical education, working with residents, fellows, and obviously with medical students in this location. You can expect, for those that are non-medical, he's an internist, so he specializes in internal medicine. He did his training in Royal Oak, Michigan at the William Beaumont Hospital from 2005 to 2008, followed by his nephrology fellowship from July 2009 to June 2011. He is a fellow of the American College of Physicians, a fellow of the American Society of Nephrologists, and he is board certified residency trained on those two specialties. So Dr. Ed is here with us. He's right now calling us from Vermont, where he is holding the title of Associate Professor of Medicine in the Division of Nephrology and Hypertension at the University of Vermont College of Medicine. And we're super excited to have him here. He also has a fantastic website and a Facebook group, thousands of followers, and many of them joining on every day, called ED4MedUS, ED4MedUS.com, that he created in the fall of 2019. And he's doing a lot of educational consultations to students, physicians, and anyone that is applying to the graduate medical education healthcare system with his 20 plus years of experience working as a professor and as an attending, working with fellows and residents. He has a lot of power in numbers and a strength to tell you how to make yourself a more robust and attractive, I would call it a sexy applicant for the residency program in the United States. So he will help you to navigate this journey. He does specific consulting, so just please visit his Facebook page. And we're extremely excited to have you here today. Is there anything that I'm missing that I haven't said in the introduction of you, Ed?
Oh, no, that's perfect. Thank you so much for that wonderful introduction. That's accurate and kind of very much encompasses, what I've achieved so far and what I intend to do moving forward for the medical graduates, both international as well as U.S. medical graduates who are, looking to get into a residency program here in the U.S.
And I know that you and I created this with a non-for-profit type of incentive initially, just because I think you and I both noted that there was a huge gap for foreign medical graduates. How do you think we're filling in the need of our listeners?
Yeah. So what happens is international medical graduates, they have, quite limited knowledge of the ground reality of things here in the U.S. I mean, yes, there is the internet. There's a lot of information. But what actually is happening down here is kind of not really, distilled and, handed out to them unless they start, really pursuing U.S. clinical experience. And what's happening and what I'm kind of looking online, there are now some services or like middlemen, middle people who are kind of like hoping to get an international medical graduate into a U.S. clinical experience, like an observership or an externship, and those are quite expensive. I mean, those costs are clearly available on the websites and can kind of go up to like thousands of dollars. And so while that is helpful, besides the scores and everything, if everything can kind of like fall apart if someone doesn't do well at the residency interview. And so that's why I kind of chose to kind of focus very much on preparing the residency applicants to do their best in the residency interviews. I think what you and I are doing, Alonso, is that we're kind of trying to keep this very affordable for the medical graduates who already have so much of a debt burden. And I really didn't feel it was ethical of me to start charging thousands of dollars for a consultation, but just enough to kind of, keep my passion in helping out others and just so that we can kind of continue to develop more collaboration with other folks like you and I who want to help out medical graduates.
Absolutely. You and I are going to try this for a few years. I think we just keep growing. Mm-hmm. So as a foreign medical grad coming into America, what kind of struggles do you go through coming into this country?
Yeah, so of course the biggest was the culture shock. I mean, when I did my medical training in India, things were very different, the whole work culture, the work ethic. And so that was like, it took me some time to get used to it. For example, here in the U.S., the work culture, it kind of wants you to be very independent and take on responsibilities and, follow through with what you said you're going to do. And so, but that was kind of not really the ground reality in India, kind of growing up there. This is like a very good work ethic to have that, if you're telling something, I'm going to do something, you better follow through on it. And and then other things like just working hard and but at the same time trying to have like a work-life balance. So that was took me some time to kind of, find a good balance between the two. Other struggles, I don't think language was a problem for me initially. Just getting used to the whole system, social security numbers, bank accounts, those kind of things. And, and also everyone goes through a little bit of a homesickness, coming, being far from family and everyone else. So that was a little bit of a struggle. But the good thing that helped me during the transition to residency was that I had a good network of friends and who really helped, helped me feel very welcome and allowed me to very quickly gel with the work culture during residency. And I think that was like a wonderful journey, 15 years from the time I started.
I know that it's more likely to have a doctor in the United States by the last name Patel than having somebody by the name Williams or Michaels. I think we represent about 1 of every 4 physicians in the United States are an international medical graduate. By the way, the other day, somebody posted on my Facebook page that I should not be using the FMG term, and actually, he is correct. We are right now dealing with a new term called the International Medical Graduate term, and I just felt that for the old generation folks like you and I, it was extremely important to kind of attract that community baptized in my podcast, the Foreign International Medical Graduate Podcast. And the international part will bring the new young fellas that are now absorbed and connected through this new generation. So what kind of population of listeners you're trying to reach to? Because in general, pretty much all of my listeners have agreed that you're required to have someone like you or me, an immigrant, to have a United States-based physician with experience on helping you through the coaching process of making it into the residency program, correct?
Yes, exactly. I think that's why, since I started my ed4medus.com and the Facebook group, I think that's what especially the applicants who applied, for the 2019-2020 residency match. I think international medical graduates were able to connect with me because I also went through the same journey, though it was many years ago. And also because I've kind of, I'm a faculty member and I interact with medical students, residents, also observers. So I kind of know, what challenges they're going through, and also served as, someone who did interviews for residency recruitment and served in the committee to develop the rank order list. So I kind of know the ins and outs of how or what program directors and faculty are looking at. So I think based on that, I think I was able to connect well with especially international medical graduates and some U.S. medical graduates too, who do have an upper hand in this whole process because they are in the system. They know it's very quickly for them to kind of, get into residency. They have mentors and faculty advisors to help guide them who are all based here in the U.S., and none of that is available to international medical graduates.
Let's dig deeper into that. And since now we have the access to these fantastic platforms like, video chatting and phone calls that you can actually feel like you're almost there with the person. The only thing that we're missing is physical touch. This has been a huge advantage, and obviously it's going to change the way we interact with people. Yep. So people are reaching out to you. I know that you specialize on face-to-face interactions via this media. Mm-hmm. What are the most common concerns that people reach out to you with? Are these people like on their first attempt, they never done it, I want to get coached and trained? Or is people that already had failures, that they have failed using other methods? What kind of applicants are you getting to your website and your consulting?
Right. I'm kind of seeing, a spectrum of, residency applicants. So, I've kind of interviewed folks who just came out of med school, and also I've interviewed folks who are like 4 years, 5 years out of med school and had to, either were not successful in matching or had to interrupt their whole residency pursuit because of maybe something in the family or other reasons. I've seen kind of all kind of applicants, really. Wow,
that's very exciting. And when people reach out to you, they say, Dr. Ed, I want to work on my personal statement. I want you to help me out with your resume. What are you looking for to enhance? And when somebody tells you, Dr. Ed, I think I have a deficiency in this part of my resume, what's your advice? What's a typical example that you get regarding that concern?
Right. So one thing that I tell, especially international medical graduates, and, and I can kind of relate to that, is that I believe that, we are very modest. We don't like to speak out about what we have done, what we have achieved. A lot of times, if someone has written a case report, then, they will say, if I ask them, what's your research experience? They'll say, I just have a case report. And I kind of explain to them, no, that's not how you need to present yourself. You need to there's a lot of work involved in writing a case report. So you need to kind of rephrase how you're presenting all your achievements. And so, I haven't really started reviewing the personal statements because I kind of started later in the year when after the ERAS opened, but I hope to do it this year, where I would like to work with applicants in refining their personal statements and ERAS resume. And few things I would suggest to applicants, again, don't be modest, don't exaggerate, but, try to show the strengths of what experience you have achieved. For example, in a personal statement, it's kind of well known that you have to develop, it's called a hook. You need to develop a certain point that the program director is going to just recognize you. For example, the program director might say, oh, you're talking about the guy who has done, who ran, 20 marathons, or maybe, that person who likes to do skydiving. You have to find a very, very unique trait that, program directors can relate to. For example, there was an observer I worked with and who shared me the personal statement. And the way, it was kind of nicely written, but kind of very traditional, hey, I studied med school and I kind of got exposed to everything. And now I'm here to apply for residency. And there was just one line there. And so this person was from Nepal where, that person, so he helped out and there was a big earthquake maybe 2 years ago or 1.5, 2 years ago. And so I kind of explained to him that, I think that's where you should start your personal statement, because there are like so few people in this world who have kind of been through that experience, so what did you do? What kind of things you saw? How did people respond in that situation? I mean, it could be like a whole personal statement just based on that. So I think it was kind of later in the game, so I don't think many changes were made. But, if someone is starting to write a personal statement, I would like, they really need to dig deep into themselves and find something that's very unique about them. So in this situation, like I gave you, that person would talk about, all right, this earthquake happened and, I was called, and first I was not sure, but then, I took it as a challenge to kind of, go ahead and do this. So that kind of shows you have some kind of community service, you kind of like to help other people out. And then, you worked hard. You were awake at night, helping people as best as you can. You saw a lot of emotions, a lot of emotional turmoils. That's what program directors are looking for, that, this is a person, a hardworking person who likes to help other people out and is well-balanced emotionally. And so all these things can come out of just this very unique thing that happened in your life. Some people might write about being a musician, say, so you have to like explain to the program director how it shaped you, how it developed the skills. And okay, I want to work hard. I'm very patient. I like to work with other team members, just like that's how music people become musicians. They have to work with other folks. And so you have to basically show how your past experiences have made you a better physician, a very unique physician who's ready to do residency.
In my personal case, I actually, like you said, I use the hook. The hook is something attractive that obviously picks up the attention, as you just said. I use the tennis situation. I saw in my interview a broken racket, a Wilson racket behind his head, like right here. And I used that. I said, do you play tennis?
Yeah.
Because I'm a tennis fanatic. And we just went on for the 15 minutes of the interview. We really developed a connection over that. And, it's something that makes you not just a piece of paper, something that connects who you are and what you want to transmit on paper, but also has to show up in the interview, correct?
Absolutely, yeah. I think it just shows a very unique personal side of you. And that's what the personal statement is intended for. It's not intended to like say again, what your experiences are, because that's what the CV tells you. That's where when you did your residency, that's when you did this and that. How is all these experiences helping you become a better physician is kind of what you're saying, like tennis or music or anything like that.
I know you do a lot of interview coaching because of your experience of interviewing residents and fellows as of right now. What are the most common flaws that you harpen on or work on to polish these applicants that you're working with?
Absolutely. So the few things that, I wish the applicants would pay a little bit more attention to. The first thing I would say is, I would really like the practice to kind of work with these applicants about 2 to 3 weeks before the actual interview. I'm not saying 6 months or a year, but it shouldn't be like, 2 days before the interview, I'm doing a practice interview, because then it's very, very difficult to refine your answers. So one is the timing of the interview. Then, some of the questions, and these are like common questions, like, can you tell me an interesting case that you saw? And, if the applicant is not able to come up with an answer for that, then that just shows how unprepared he or she is. So certainly they should be I would really like them to at least, think through the common questions that, there are a lot of websites and a lot of stuff, even my blogs, where we talk about common questions. And then things like, if I, as the interviewer, am asking the applicant, do you have any questions for me? Again, I don't think it's, there has to be at least one question. One question, maybe, even if you've asked someone else, you should really have a question. And, there are some challenging questions like, tell me your strengths and weaknesses, that kind of a thing. The weakness is a part where, people sometimes are not able to like clearly say. And that's where I help them out with. And then there are some questions like, why should we take you into our program? Kind of very traditional questions.
That's a big one.
That's a big one, yeah. They kind of like to ask that in the end, just to kind of like summarize everything. Lately, from what I'm reading, there has been a lot of interest in asking behavioral questions, because I think program directors know that, everyone's going to be prepared to answer the very common questions like, tell me about yourself, or what do you want to do after residency. But then, putting that applicant in specific situations, scenarios, and see how they would respond in those scenarios is, I think, what the program directors are looking for.
To clarify to our listeners, when you say behavioral questions, can you give me an example so they know what we're dealing with?
Absolutely. So, these are questions, sometimes we hear about, okay, you're on call and you have your colleague, your co-resident, and you smell alcohol in that person's breath. Or things like, you made a mistake in, like, for example, you're doing a procedure, you're putting a line in and you kind of made a mistake. So what do you do in that scenario? How do you, what do you tell the patient? What do you tell the family? What do you tell your attending? Those kind of scenarios are something that the applicants are going to be increasingly asked about.
One concern that I had when I came to this country was the etiquette. How to dress, how to communicate, how to tone down myself as a Latino, avoiding the drama and the over dramatic statements that we make, how to tone myself to become more American-like. I know that there is issues with etiquette. And you said specifically that you personally struggle with the culture shock. Yeah. What do you think has to happen in the applicant to change a little bit to adapt to be more likable by the residency program directors and the interviewers?
Yeah, it's a big transition. And, for myself, kind of my personality is more of like an introvert. So it kind of, I didn't really fit well with like a more extrovert kind of a setting, which, I understand is a more common kind of personality type in the U.S. work culture. But then, I tried to be myself. I try not to crack any jokes that, might be considered offensive, or try not to use like, things that I might have heard in a movie, thinking that, people are going to understand it. I think I would just try to keep it for example, even now, I'm not able to like tell a patient, do you get Charlie horses? That's kind of not me, even though I hear it all the time about neuropathy and sciatica and everything. So I would say just be yourself and just pay close attention to what's happening around you. And I try to keep a very low profile, not get into trouble. And I think I did very well with that. And I think just be yourself. That's all. That's kind of the key message here.
I think the reason why I wanted to bring you specifically during this week is because we know how important is this week for everybody. Yeah. And what we're talking about here, this is the match week. Mm-hmm. And with the whole coronavirus craze, and I think that has really detoured the concentration of many people in our community. But I think the match just happened. People found out on Monday that if they match or not. Yep. And on Friday, they will be told exactly where they're going to go. So I know you launched your program ED for Med US last fall, during the fall. And this is the first time that you go through the match season. What has been so far the feedback on the success or not of most of your consulting individuals that you're working with? Yeah.
So, the applicants who have matched, they have reached out to me and they send me thank you emails, and they've kind of started posting reviews on my Facebook page. And of course, I haven't heard from some of them, and I really hope they're still doing very well. If I have to guess, I think they're kind of going through the SOAP process, which itself is, very stressful, and it's a very anxious time for them. For what I've done, I just try to look up if there's a lot of, discussion on Twitter about people going through the SOAP process and some kind of an inspirational story. So I kind of just posted one maybe today or yesterday, just to kind of, offer some support to the folks who are going through the SOAP process. I wouldn't have any numbers exactly to say how many matched or not, so... But, I'm very glad to hear that that some of the folks, for example, there was one person, he mentioned that he just had like 3 interviews and really, really wanted to do his very best, and was very thankful that, we did the practice interviews and gave him a lot of confidence to kind of perform at the interview. So I think even making a little bit of a difference and helping the applicant, I think is a wonderful thing. And of course, there are limitations as to how much, as consultants we can do, because in the end, it's the applicant who has to, either interview with the program director and has to do it in a very calm and composed way and kind of go from there.
I know you're very active on the internet. I'm actually remarkably impressed about the fact of how much good content and material you're posting on daily basis. How a busy practicing physician with a busy nephrology practice, assisting to run a residency program, rounding with the fellows and residents. How do you get time to do all this for people? I mean, I know that this is out of the goodness of your heart, but where do you find time? Because I'm telling you the truth. I find myself sometimes in between my kids, my wife, the family, and work, having no time to do anything. I know that I'm doing it for fun, but how do you do it? It's awesome what you're putting out there.
Yeah, I mean, I think it's important to be consistent in one's efforts. So if I just post something a month and not post for 2 months, people are not going to appreciate what I can do and how I can help others. So I kind of keep looking for content, any piece of news, newsletter on Twitter or Facebook, other groups, anything that I feel is relevant to the residency applicants and could help them out. I kind of just take that information and, kind of post it out there. And I try to keep it like 1 post a day just to kind of, I have like a daily content for everyone. And that's working out so far, it's working out well. And yes, at times it does look like, hey, I'm going to run out of content, but things keep coming up and, there are a lot of news events that keep coming up. So I'm always on the lookout for something that will inform and educate the applicant.
Definitely. I would say that what we're doing is the content is coming up from our followers. And the more you keep liking us and the more concerns you keep sharing on the internet, on Facebook, private groups, and etc., the more it's going to help us to put some free material out there for you guys. So keep doing that. So, Dr. Ed, I know that people after you and I talking right now are going to try to get a hold of you. What is the easiest way to find you on the internet, or how do we connect with you?
So the 2 ways I would suggest is joining my Facebook group. It's facebook.com/groups/ed4med US. So ED4MEDUS/. I would highly recommend that, because then you can kind of, as an applicant, you can get all the latest content, information, and also engage in discussions. I think that's what I'm trying to do in the group, is to have people post questions and, hear feedback from other applicants and certainly me. And the other way is my website. It's www.ed4medus.com, ed4medus.com.
And that's all going to be down here at the links of my podcast, and also it's going to be on the YouTube page. So feel free to welcome him, and I will redirect you to consult with Dr. Ed. Dr. Ed, this is super exciting. So I have one question. Since recently in early January, late January, early February, the USMLE stated that we're going into a pass-fail score. How do you think this is going to affect international medical graduates or any grad? And do you foresee that people are going to need to shine more in the interviewing process, more than a 3-digit number as it used to be?
Yeah, so, that whole pass-fail, the change in the scoring for step 1. I mean, people have looked at it both ways. Some feel that it's a good move. It kind of relieves some of the stress of preparing for step 1, and that, programs should not focus too much on the step 1 score. I mean, if you look at how, NRMP has this data, where they surveyed program directors asking, how do you guys, decide whom to call for an interview? And USMLE Step 1 score is like on the top of the list. So having said that, for an international medical graduate, I think, there are a couple of ways I've kind of looked at this. The way it works for international medical graduates is a lot of us take the Step 1, much later in medical school. I mean, for example, I took it like after I graduated, and in the US, it's like this, they take it in the second year. The US medical graduates take it in the second year of med school. So, and so by the time, one finishes med school, it's very difficult to kind of go back and learn like biochemistry and anatomy and embryology, those kind of
basic sciences.
Basic science, that it's very difficult to like be excellent in that. And so I think from that point of view, it's like, okay, we just need to pass in this exam. So that's one good thing for international medical graduate, and focusing more on the clinical sciences, which is really the information you need to take care of the patients. Some folks have said that, have kind of expressed their views that, for an international medical graduate, having a high score on Step 1 was kind of one of the ways they would show to the program director that, hey, I'm really good at, I'm very good in my clinical knowledge. And so some feel that now they would not have the ability to show the program director that, about their clinical knowledge, the basic knowledge. So, yes, so then, the focus will be more on doing better on the USMLE Step 2 CK, making sure they pass the Step 2 CS the first attempt, maybe focusing more on clinical experience and research. I think it's going to like move the whole method of how program directors decide whom to interview will kind of change.
As a practicing physician and working with a university teaching hospital, just give me an idea of how many applicants for internal medicine you're having every year that you need to sort through, just in total applications per interviewing season.
Yeah. So I understand that for every position, they're kind of interviewing about 8 to 10 candidates for a position. So here in my program, if it's like 20, they take 20 residents in a year. I have heard from the program director that they kind of interview anywhere between like 160, 150, 160 applicants.
And probably you're going to have more than 1,000 applicants per interviewing season. I heard something ridiculous, like in the numbers of the 4,000 people applying for one residency program.
Absolutely. I mean, I wouldn't know how many applications were received, but yes, it's a humongous number of applications. And that's why, there are all these filters that are placed to kind of narrow down, the number of applications that the program director needs to review in order to decide whom to call for interview.
How likely is that with this new scoring system, us foreign medical graduates are going to be able to make it into highly competitive specialties and not settle, quote unquote, for internal medicine or family practice like I had to at the very beginning before I went actually into the specialty of my choice, emergency medicine?
Yeah, I don't think it will change that because, the reason why specialties like ophthalmology, dermatology, orthopedic surgery are competitive, it's not that because, they're looking for high Step 1 scores. Traditionally, those specialties, are more accessible to U.S. medical graduates as compared to international medical graduates. So, and, I don't believe it's entirely because of the score, the Step 1 or Step 2 scores. I think it has to do with how you did during your med school and the kind of letters that you have, maybe the kind of research you have done. So I don't believe the Step 1 pass-fail system is going to make it more difficult for international graduates to get into competitive specialties. They would still need to work on their Step 2 CK and all the other things to kind of get into a competitive specialty, I would think.
You said earlier that you also work with people that are doing observerships. My perception and my feeling is that every day is getting more difficult and, if not difficult, more expensive to find an observership. And definitely a hands-on rotation is really hard to get by. What are you advising the people that are successful at finding an observership to concentrate on during those 2 to 4 weeks that they're working with and attending?
Absolutely. As an observer, the role is quite passive for an observer. They're basically shadowing you. They're kind of looking at what you're doing. When I've had observers, the first thing I would ask them is, if they have any topics or any questions that they would like me to discuss, just to kind of have an engaging teaching moment. And, there were some observers who would like me to talk about dialysis or some electrolyte disturbance. Some were like, no, they didn't have anything to ask me. And so that again, so I would really highly encourage an observer to have some questions to ask the attending, or at least, if the attending is showing an interest in teaching, that you take full, benefit of that. There's a lot of downtime, they need to wait for the attendings to write their notes and everything. I would suggest an observer to ask the attending to see, hey, I know we saw this patient, is there anything that you want me to research, do a literature search about? For example, I wrote in one of my blogs, so we had 2 observers, and there was this whole question about polycystic kidney disease, and there's this medicine called tolvaptan. And so when he asked me, hey, do you have something that you would like me to research on? So I would think back about a little bit of a literature search on this thing, but I just didn't get time. So I kind of told the observer to look at the literature and the guidelines as to what's the benefit of using tolvaptan in polycystic kidney disease. And that observer did an amazing job putting all the information together. I would highly recommend observers to do as many presentations as they can. Again, evidence-based medicine. So, some again, feel again modest or shy about doing this, but I would highly encourage them not to do that, because we all know that observers are coming for getting letters of support. So the more excitement and energy you can show in your observership, it's all going to reflect in the letter. So, do try to present at least one topic every week to the entire division if you can. Or certainly your teaching attending who's with you, just make sure you can present something on PowerPoint every week. Of course, they are allowed to review charts. They cannot put notes. So do ask, if there's a question that comes up on rounds, do ask them. And do take the effort to, search on UpToDate, search on the literature and say to the attending, hey, I read about this medicine is kind of contraindicated in people with acute kidney injury. What are your thoughts about that? For example, I had someone with taking baclofen and who had acute kidney injury. So there was this whole discussion about it. So I think there's a lot of content that can be seen during an observership. It's just that they need to capitalize on that. They need to say, okay, this is an opportunity. I can help the attending in their literature search or put together a PowerPoint and go from there. Some observers, do help out. They also do look for research opportunities. I mean, it's impossible to do any research in 4 weeks, but, at least you might be able to identify a mentor and see if you would be, they need help writing a paper or a review paper or something that you can do remotely also. So those are a few things. I highly discourage, observers to be chatting on their phones while waiting. It's kind of not very respectful to do that. If nothing much is happening, they should just, go to the library or read something or do some research and kind of go from there.
This is awesome material that you have suggested to us. So I'm going to just change the topic really quick.
Yeah.
Right now with this crisis of the COVID-19 and coronavirus, how this is affecting your private individual practice and what's the environment in your clinic and in the hospital right now with this craziness and how much of an involvement they're asking you to play on this pandemic?
Exactly. So, as a nephrologist, I'm the medical director of a dialysis unit. So it gets even more complex in someone who is a person who needs dialysis and might be COVID-19 positive because of some of the respiratory symptoms. And so, I've kind of just been working with the management to try and come up with, how are we going to isolate them? What are we going to do? And work with infectious disease. I was on call yesterday night, and, we kind of just had a very similar situation. And, kind of all non-essential, like the clinics are kind of, just like telemedicine or phone, interviews are being done right now. So all like non-essential or things that can wait are being rescheduled to a later date. And, with regards to the teaching, everything's kind of become remote right now. Medical students are not like, sitting together or so, in a lecture hall. And observership also, that's kind of like, closed now. Because, again, we don't want observers to kind of be in a dialysis unit with, where they can potentially get sick.
Wow.
So, so all kind of things that are non-essential have really been like, cut down.
Well, it's been awesome. I just wanted to get your point of view on what's been this experience because our 2 prior episodes are going to be about COVID-19. And I think we need to take advantage of this moment to generate some public health education to kind of calm the fears and at least to tell people to stay home and isolate themselves. Dr. Ed, Dr. Varun Agrawal, this has been fantastic. I'm going to link you guys so you can visit him. If you want to get a hold of Dr. Ed, I would say this is the moment so we can start planning ahead for the future, for the next matching season. As he said, usually he's going to be really busy for the 2 to 3 weeks prior to any interview that you're going to have. And for all those residents that match, those medical students that match, I want to congratulate you and wish you good luck in the next 3 to 5 years of your education. And Dr. Ed is here for you. He's doing some fantastic stuff and he's putting some good material out there. So just follow him on his Facebook page. And I just hope that business keeps growing and foreign medical and international medical graduates are extremely appreciative of your job, especially knowing that you're such a busy physician.
Yeah, sounds good. Thank you very much, Dr. Alonso. Really appreciate it.
Thank you for your time.
Thank you.
So for everybody, please remember to follow me on Facebook, Instagram, and visit my webpage. I have plenty full of good information. I have a couple of episodes that just came out actually today regarding COVID-19, and I think you're going to like it. We're going to resume our educational lectures on this matter of getting involved foreign medical graduates. Tomorrow, we have a special host, Dr. Giselle Melendez, that is going to tell us more about research and how to do research in the United States. She's an extremely involved physician, MD, that is working at one of the most prominent universities in the United States doing some significant research with primates as well. So we're going to find more about this tomorrow. So just keep an eye on that and download, subscribe, and share, because remember, sharing is caring. Dr. Ed, thank you for being here. Thank you for participating. We really appreciate it. Thank you.
Sounds good. Thank you very much.
Have a great day.
Yeah, you too.